Death can result from this because with AFib, there's an increase of what's the word I want? Blood flow isn't clean. It sits in the atria for periods of time because it's not cleanly pushed through. As it sits in the corners and the pectinate muscles, platelets settle out, and blood clots can be triggered. So death usually occurs 20 to 30 years after the onset, or 15, but usually 15 to 20 years after the onset of AFib from a stroke or an MI due to a blood clot, not directly the AFib. Okay? One of the characteristics of AFib also is an irregular heartbeat. So you may have a varying amount of time when the heart is at rest. And if you've heard the public service announcements on the radio, I haven't heard them for a while, but used to hear them every month or so. They'd ask you to check your radial pulse for an irregular beat. What we'll do in lab when we do blood pressure and pulse is a little bit better, where you can compare apical pulse, the heart rate, to the radial pulse. So if you have two ventricular contractions close together, a little bit, I can make it a little bit more dramatic here. With this short period of time, there's not much blood going to be in the ventricle. If you're listening with a stethoscope, you will hear two ba-boom, ba-boom, like that. But you won't feel that second pulse at the radial artery because there is not enough blood ejected to expand the vessel. So if you compare an apical pulse rate, you might have something like 78, where at a radial pulse you may have, 70. And so that's an indication that you're having more apical beats than you're seeing at the radial area. So that's AFib. Okay, ventricular fib is life-threatening because we're having that quivering occurring in the ventricles, and there is no stroke volume. There is no movement of blood, just every muscle cell for itself, and there's no circulation. Okay, so we're not getting oxygen transported throughout the body. So that's not going to last for a very long time. So when someone is defibrillated or the defib paddles are applied, what's occurring?
Shock.
So they're given a strong electrical current, all right, completely depolarizing all the cells, and the hope is that because the SA node cells recover the fastest, they'll take over. It's kind of like having a room of, 40 kindergartners, everyone running around and doing what they want, and the noise is so loud that nobody can hear you. And so you have this huge cannon that goes off. They're stunned into silence. They can't hear each other. And you have a few moments that you might gain control before madness erupts again. So it's kind of trying to shock all the cells into quiescence so that the SA node can then take over. All right, on the next slide, several different forms of heart block are shown. You don't have to tell the difference between them, but this is where there's damage, usually to the AV node. It might be to the AV bundle or bundle of His. It might be due to because of drugs. It might be due because of localized heart attack. But the signal is having the cells are not depolarizing properly, and the signal isn't getting through that conduction pathway. So remember, that's what's occurring here. So if we prolong, exaggerate that, this is the time it takes for the signal to get from the AV node down to the ventricular contractile cells. If we interfere with that, okay, if that takes longer because of scar tissue, then you will see this. And it usually is not the same each time, but you'll see varying degrees of extension of that PQ interval. So with heart block, there's an increased T2 interval. It may be so long as you see here that there is no QRS. All right, and then finally you get a QRS. Obviously there has to be one or you would die. Yes.
So it's not considered a complete heart block unless it skips a
Yes.
QRS.
So here's the P wave. Here there's no QRS. Here there's one here that's right on top of the T wave. And it's just variable. Okay. PVCs, I'm not going to diagram. It just shows what it means. It's a premature ventricular contraction. So it's often described as an ectopic heartbeat. So in addition to the SA node firing, the AV node may depolarize faster, or send another one, or there might be some site in the ventricular muscle that depolarizes and sends a signal throughout the heart. This can be caused by drugs. It can be caused by damaged heart tissue. Sometimes they'll go in there and fire a laser at it and get rid of it that way, if it's causing a problem. When my oldest son was around, it's still a mystery whether he has heart problems or not. I have no idea. But when he was 2, we were visiting a couple. They were both physicians, and they couldn't have kids. So she kept this big box of toys for visiting kids. And my husband and I were talking to her husband, and she was playing with our 2-year-old. And I remember she looked up at me and interrupted our conversation and just said matter-of-factly, "You've had Christopher's heart checked out, haven't you?" And he had all his pediatric appointments and everything was normal. And I said yes. And I went back to talking, and she never pursued it. And I don't know why I didn't say, "Why are you asking?" I mean, I just totally ignored it. And then about 4 months later, my son and I were back in Georgia. We've gone down to Atlanta with my sister to Six Flags. And Chris needed to use the bathroom, have a bowel movement, and he came out and his lips were just dark purple. And every time he took a bath, his lips would get purple. And around his mouth would get purple. And I just figured he was cold. But this, with the hard abdominal compression of trying to have a bowel movement. And I mentioned it to my sister, and she was a former heart transplant pediatric nurse. She said, "When we get home, 2 hours away, let's listen to his heart." She pulled out a stethoscope, and it was boom, 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 boom. It was all over the place. Now, when kids don't get enough oxygen, if they have a hole in their heart or something, they'll run around, they'll just stop, and they'll squat. And he never did that. I knew that from my nurse's training. So he was pink and chubby face. He had a cold. So he was on Trimin. Got back to California 2 or 3 days later. Called the doctor's office. Made a follow-up appointment. My sister suggested he wear a heart monitor for a 24-hour period. Doctor canceled it because of a flat tire or whatever. So it was about a week before I went in. In the meantime, I had gone to the library at the UC Davis because I was teaching at the medical school there. Spent about 3 hours, and I finally found an obscure documentation that Triminute could cause PVCs. So I took them off, stopped the Triminute, and it's no longer actually suggested for children. You can't find it. When we finally went into the doctor's office, his heart sounded fine. And I told the doctor about the cyanosis in the mouth and everything, and he said, "Well," he said, you're an RN, you just worry too much." Probably was just the cold water. And I remember coming home to my husband saying, "We could put him back on the Triminute and cause this to happen all over again. But I don't want to do that." And so I was like, "Well, we could pay for, a heart consult on our own," but we never did. And and then he, failed his basketball physical because of high blood pressure, and then he had the heart palpitations and fainted in the shower at college last year. So it's just always in the back of my head. So he came home on spring break last spring, dragged him. Of course, he's 20 at the time. He has his own, I can't even read his lab results because of privacy once you're 18. So I was in the doctor's office, and the doctor said, "So what do you want?" And I said, "I want a consult with a cardiac specialist. I know he's had a stress test. I just want to lay everything out. I don't want to worry every time I watch him play basketball. Because, was it 2 years ago? There was a college kid who, I don't know, it's this little college town back east. It was their last game of the season. They had just won the game. Everybody's congratulating him, and he crashed on the floor. They had a defibrillator, but it was in another building, and they ran and got it, but the battery was dead, and they weren't able to save him. So all this stuff, you know, is kind of still in the back of my head. And my son went back to college 2 hours away. It's like, okay, honey, have you made your appointment yet for your consult? So it's a year later now, he still hasn't done that, and it's just bugging me. But that's one of the that was one of the effects of that drug. And there's other things that can cause that. Okay, 2 more things, and then we'll take a break. Acute myocardial infarction. That's a heart attack. Okay. Not just lack of oxygen to the tissue, but it actually, some of that tissue actually dies. That's what an infarction means. And there's a variety of the 12 leads that appear, but the one I want you to recognize is in the ventricles. If there's death of ventricular tissue and scar tissue resulting, it's going to take longer for the depolarization and repolarization and recovery. And the easiest thing to recognize is an elevated ST segment because of that change in the amount of time it takes. So we have our standard P wave through our S wave. The S comes up higher, and then we have an elevated T segment. So this is that characteristic of a myocardial infarction. And it's due to the blockage of ventricular muscle tissue for the current, the depolarization, repolarization to occur. In a similar fashion, but on a different component, when we look at the appearance of mitral valve stenosis, which I'll define in just a moment, it is the P wave, and I've exaggerated it here, that becomes enlarged. So which valve is the mitral valve? Left side or right side? Left side. Atrioventricular valve. All right. Mitral stenosis occurs with the thickening of the valve leaflets. There are only 2, and they don't close correctly. So without being closed, when the ventricle contracts, blood is pushed up into the left atria, not only out the aorta. As that occurs, it gradually causes the left atrium to expand. It stretches it out. With it stretched out, it takes longer. There's more distance for that current to depolarize. And so we see an increase in time and tissue with this expanse for the atrial depolarization. Okay. A friend of mine, we have a case study, mitral valve stenosis and replacement. A friend of mine from my childhood, she will be 94 in April. The sister just turned 104. And is actually better physical health than she is. All she is legally blind. My friend developed congestive heart failure and is on oxygen. And about 3 years ago, they decided the cause of the congestive heart failure was his mitral valve stenosis. Now, to replace the mitral valve requires opening the chest wall, cutting the ribs, opening the chest wall, opening the heart, an open heart surgery, taking out the valve and replacing it either with an artificial valve or a pig valve. 3 years ago, almost 4, an experimental procedure was being utilized in about 16 hospitals across the United States, one of them being Cedars-Sinai down in Los Angeles, and she was accepted for that procedure. They're now doing it in Sacramento no longer as an experimental procedure. She flew down with her son, went in, had a heart catheterization through the large vein in the thigh, sending up camera, the valve, surgical instruments, and through the vein and that equipment, no open heart surgery at all. They took out the disease valve, replaced it. She went to her hotel room that same day, stayed in the hotel room 2 or 3 days for checkups, and flew back to Lodi, California. No open